Trump officials move to allow Medicaid work requirements. The Trump administration on Thursday unveiled guidance allowing states for the first time to impose work requirements in Medicaid, a major shift in the health insurance program for the poor. The move opens the door for states to apply for waivers to allow them to require Medicaid enrollees to work in order to receive coverage. Something that has never before happened in the 50-year history of the program. Huma, the administrator of the Centers for Medicare and Medicaid Services, CMS, says the move will help people get out of poverty. Our policy guidance was in response to states that asked us for the flexibility they need to improve the programs and to help people in achieving greater well-being and self-sufficiency at MSI. In a statement, Democrats are sharply opposed to the changes, saying people will lose coverage if they can't meet the requirements or simply because new bureaucratic hurdles will discourage them from applying. Democratic groups are expected to sue over the changes, arguing that the administration does not have the power to make them without action from Congress. Approving waivers from states must be done to further the objectives of the Medicaid program, which Democrats argue is not accomplished by a policy that could cause people to lose insurance. Today's attack on Medicaid is just the latest salvo of the Trump administration's 2018 war on health care, Brad Woodhouse, director of the pro-Obamacare group Protect Our Care, said in a statement. Having faced overwhelming public rejection of the failed attempts to repeal health care, Trump and his congressional Republicans are now going for death by 1,000 cuts. Asked about the possibility of dropping Medicaid enrollment as a result of the new policy, Huma said on a press call that it is a good thing if people leave Medicaid and find coverage through employers. People moving off of Medicaid is a good outcome because we hope that means they don't need the program anymore, Huma said. The counter-argument is that people could also simply become uninsured if they are forced off of Medicaid due to the new requirements. Huma also defended the legality of the move when asked about court challenges, saying that the waiver language in existing law gives the administration broad authority. Experts said the move is a dramatic shift in Medicaid. Conditioning Medicaid eligibility and coverage on work is a fundamental change to the 50-plus year history of the Medicaid program, Mary Beth Musumeci, Associate Director of the Kaiser Family Foundation's program on Medicaid and the uninsured, wrote in an email. There is a real risk of eligible people losing coverage due to their inability to navigate this process, a miscommunication or other breakdowns in the administrative process, she added. 10 states are currently applying to impose work requirements in Medicaid. Many experts expect Kentucky will be the first state approved.